talk about the DNR?
Yeah.
We had a situation where my brother and his wife, my brother had lung cancer, and his wife had COPD. And they lived in another state, and he had to go to the hospital one time, just some small treatment for something, and they convinced him at the hospital that they both needed a DNR. They signed it without even questioning it. And so he ended up having to go. The medicines, they had treated him for his lung cancer. It wasn't spreading, but the medicines that he had to take for pain constipated him tremendously. So he had become so blocked, I guess, and the pain was unbearable. They went to the hospital on the weekend. The doctor was not there. Because he had a DNR on file at the hospital, they did nothing but give him morphine. The doctor came in on either Sunday night or Monday morning and started throwing everything at him that he could to help with this blockage, but they had given him so much morphine for pain, he just expired. So then his wife later had pneumonia. We didn't know at the time, we just thought she had a cold. They called an ambulance. And because she had COPD, which so many of us have, I had told her after that incident at the hospital not to do that. You know, that she needed to talk to a lawyer before just blanket signing something. Sure enough, her heart stopped in the ambulance. Had she had the DNR, they would not have brought her back. But all she had was a case of pneumonia. Just needed enough time to get in the hospital and be treated with antibiotics and get over it. But had she had a DNR on file, that one, because I told her to tear it up, they wouldn't have brought her back the first time. And this has been, I forget how many years ago now, and she's leading a full and active life.
That's why everybody needs to understand what that tool means.
And unfortunately, we do that. This is what I do day in and day out. Talk about it. Sometimes, I'm not going to lie, sometimes physicians don't understand what a DNR means. DNR doesn't mean do not treat. Some people think you sign a DNR, well, like you said, I'm just put them on morphine and we're done. That's not what a DNR is. A DNR specifically addresses, so people think if you sign a DNR, I can never be put on a ventilator. Not true, but some doctors think that. For instance, your sister-in-law has pneumonia. Even if she had a DNR, has pneumonia, comes in, has respiratory problems, you can be put on a ventilator for a period of time to recover from pneumonia.
And they did do that.
Yeah, and so I think there needs to be education not only for patients, but there's providers that need education about a DNR. Trust me, I've seen it, what that means. And so a DNR is specifically should address one thing, and that is if you have a life event when you literally die, are we going to attempt to bring you back? Okay. Not your pneumonia, not that you got a fast heart rate, we want to try to slow it down, not, people with COPD, and so I think you need to make sure you understand, yes, what you're signing, and number two, what it means, okay? So you can be a DNR and still come to the hospital, get antibiotics, be even put on a breathing machine if you had to for a limited period of time. Now sometimes your family then will have to make some decisions if you don't recover well enough and aren't able to come off the ventilator, what you may want to do at that point. And I think that's where it's clear to have your advanced directive done, to have it clear on what you would and would not want. Such as, would you want a tracheostomy? Would you want something that advanced if your breathing got that bad? And so I think that's why these two forms go hand in hand. I will say, in Virginia, hopefully starting this summer, there is going to be a new form called a post. We're not even close to having this, and I'm not even getting into all this, educated, because providers aren't educated enough, so we can't educate families yet. But in this post, it will be a dual form, where you can lay out things that you do and do not want, and as well as the DNR is embedded into that, so you don't have two separate forms. Okay, that's coming. That'll make it easier on all of us, I think, because it talks about even like pre-coding, like what you would do if your heart stops versus in the midst of the hospital. So there's things that'll be a lot more clear, I think. But there is confusion on the DNR and what that means for not just patients but providers as well.
With this post coming out, how do we find out when it's out and where do we get one and learn about it?
Yeah.
I'll be back soon.
Yes. That might be another lecture for a few months from now. And so, I mean, in all reality, we need to educate a lot of people, like particularly ER providers, I think are gonna need to be educated on it. EMT people, emergency ambulance people are gonna need to be, EMT are gonna need to be educated on it. We're probably, to be honest with you, our group is probably gonna be doing some of that education. And so, at least, I can't speak for HJS, but at least in the bond support system, over the summer, which is, we're in the summer almost, supposedly that education is supposed to be coming for all staff, and then we can educate patients after that, so.
Just, I've had the opportunity, but sometimes, for two instances, my mother and my wife, both, I was in charge of the directive, and both situations, something was asked to be done for comfort, or they had to do one test, but they would not do that test because there was a DNR in place. I was able to rescind for both of those that DNR. I was in charge of that, so I could say, yes, let's try that, and then if it doesn't work, then we can put that back in place. Just keep that in mind. If you're in charge of your directive, you can rescind it. If you have a good reason.
We don't even have to rescind it necessarily. Similar with my mother, he wanted to try hyperal, which some people would consider heroics. And, we agreed to it, but we didn't, the heart thing was still the same. And we tried it, it didn't work. But, if you have a good physician and y'all have good communication, and I was her advocate, all you gotta do is talk about the specifics, and you see what works. So, yeah, and you don't even have to totally rescind that to do that, but just talk.
Well,
The
that's
lines of
what they call
communication,
the just.
and that's why his staff, with the social worker and so many people, that support is just so important to give you that opportunity to have the test.
It gets complicated, and it sounds like, quite frankly, you probably didn't even need to rescind it. They probably just needed to know the risk. For instance, I have patients that we take care of in their hospice. Let's say they have lung cancer, but they fall at home and break their hip. Okay, what are you gonna do? You're just gonna leave the patient lay at home with a broken hip? No, you're gonna bring the patient into the hospital, get their hip fixed, hopefully, if they can. I mean, if they're able to, and then you reenact hospice after their hip's fixed. And in that same setting, we often rescind a DNR status so that you can have anesthesia and be put to sleep and woken up so you get your hip fixed, and then it kind of gets put back in place, usually 24 hours after surgery. And so, yeah, so there's things all the time with DNRs that kind of you have to play with a little bit depending on what's going on with the patient.
So this form, is it gonna have more specific things? That's what's gonna be different about it?
And sometimes when you do a medical directive, like your DNR, are they filed with the state?
It's not filed with the state. And at least in the bonds of course, we try to, if you have an advanced directive or a DNR that's been signed, we scan that into our system so that it can be seen in any bonds of course system. Unfortunately, there's a little battle between these two systems, or three systems in this area. It'd be nice if they all communicated, where we could see everybody's, because that's best for the patient, I think. But that's not the way it is right now. But if you come to a Bon Sports Hospital and you have something like that, I try to always get patients to bring it in, or family members bring it in, so it can be scanned in, so you don't have to ask that question 1,000 times every time they come back, because you can just read it. So, but you're right, it's not with the state. Yes, ma'am, in the back.
Is palliative care allowed to do medications? Like my husband had cancer, and the doctor said he would be getting pneumonia. So when I had hospice come out to talk to me about him, I said, the doctor said he'd be getting pneumonia, so will we be giving him antibiotics? And she said, no, for what? So we do more tube feedings? And then the next day, the caseworker said, we're soon gonna have to stop the tube feedings. Does palliative care do that?
The answer to that is yes, and we would walk you through some of that. But even, I would say, I would argue, I'm not sure what hospice you had, but
I'm not.